Good morning, everyone. So we are going to do this workshop mainly focused on pediatric poisoning, right? So to start with, we do 2 lectures, right? So I'll be doing kind of an introduction, right? And the second one will be like giving you some knowledge into the structured approach to managing a child with poisoning. And then we'll be rotating across 6 workshop stations where you'll get exposed to various types of poisons, and then you get the chance to interact, ask questions, do various activities, and then learn from those scenarios, right? I hope you all have responded to the pre-test question. If you have not, please use this time to respond, right? Yeah, so let's start. Right. So if you take acute poisoning, it's a global health issue, right? So not just in countries like, our part of the world, but it's common in everywhere, as you all know. And pediatric exposures continue to be a significant problem, right? Although, its face is getting changed, like, some 2-3 decades ago, we used to see a lot of kerosene oil poisoning, kind of, when at an era where people didn't have electricity and kerosene oil use, but now we see more cosmetic poisonings, the other side, cosmetics, pharmaceutical poisonings, right, with people having more access to such type of agents, right, and also a lot of household chemicals, including washing powders and various types of common household poisons. But it is preventable largely. Mostly happens accidentally. Not only it can cause physical harm, injury, and morbidity, but also it can sometimes cause emotional, economic burden on families, right? For example, somebody may be left with lifelong problems if you drink an acid and then end up having pain, difficulty in swallowing, right? So it can have a long-lasting impact. And most of these events reflect the level of home safety, supervision by parents, as well as gaps in public health, right? So, in our country, like generally it's a practice, like when a child comes to a pediatric ward and then go home, we tend to inform the community team, like including the public health midwife, who is the closest health professional to the local families, right? So they can go and pay a visit to the house and find out whether there are any concerns of home safety. And we look at the global overview of poisoning. So this is from recent data published in 2025. As you see, the red areas include the higher number of, higher densities of mortality, right? And the highest risk, if you take Africa and, where the health care system is very poorly developed, their mortality is quite high, right? But, our country, although our economy is not that great, but our health level of healthcare is kind of in par with most of the other developed countries, right? So we don't see that level of morbidity because of the quick action and also the quick action by the parents. And children are susceptible to poisoning. You can see 2 peaks, right? The first peak is the toddlers, right? So they, like 1 to 3 year olds, typically they ingest poisons accidentally due to their inquisitiveness and need to explore the surrounding test, right? And then you tend to keep everything in your mouth, and then at the same time you might sometimes get one of these things and then you put inside your mouth and then get exposed to a toxin, right? Whereas adolescents, we see a lot of recreational drug exposures. They tend to experiment. They know, and they want to, maybe with the peer pressure, maybe with, kind of emotional distress, right? Because of their emotional immaturity, and then exposed to various stresses, you tend to do it as an act of deliberate self-harm as well. Right. And some of the poisons, they can be lethal to younger children. For instance, like agents like tricyclic antidepressants, although it might not kill an adult patient, just one tablet can kill an infant, right? Because of their low body weight and the higher toxin concentration. Same with various other cardiac drugs like beta blockers, calcium channel blockers, ACE inhibitors, antiarrhythmics, and also some of the respiratory drugs like chlorphylline, which can be cardiotoxic, opioids, right? So they all can be very much poisonous in younger children. And compared to adults, managing a child with poisoning can be challenging due to several reasons, right? One thing is, these children are developmentally vulnerable. So managing children at home before a poisoning event happens can be difficult because you don't have the ability to sense danger. So you always tend to explore, put things in your mind. So they are inherently vulnerable because of their age, right, and the lack of understanding. And children, once they ingest a poison, their liver and kidneys may not be mature enough, especially ingested by a younger child. So the drugs that are excreted predominantly by liver or kidney, they have a chance of getting accumulated and becoming toxic compared to an adult, right? And also they have rapid and unpredictable clinical deterioration, right? Sometimes you don't tell it until the parents don't pick it up until the child becomes symptomatic, until the child starts vomiting. No one knows, right? So that may be late. And then sometimes some of the poisons, there can be sudden progression, like within a very short time, they can present with severe complications as well. And diagnostic uncertainty. So they may ingest multiple substances, right? Unlike an adult, because they tend to ingest just one or two, like discrete, paracetamol, right? So they just eat paracetamol like adults, but child, may bring a collection of tablets, without knowing how dangerous it is, right? And also age-specific management constraints, especially sometimes we find it difficult to calculate the antidote doses when it comes to children. Managing airways, if you need resuscitation in a smaller rural hospital and who needs attention to airway, managing airway can be quite challenging because airways are small. Cannulation can be sometimes difficult, especially in younger children, especially in emergency. Monitoring can be difficult. High risk management errors for the same reason, right? Sometimes those calculations, doing the correct risk assessment is often difficult in children compared to adults because we don't know the exact dose, we don't know the exact drug because of the lack of history. So we always tend to go by the missing pills, anything spill on the floor. These are kind of very crude evidence. They are not very hard evidence. And system and contextual level factors. Sometimes even the poison information services, they are not very well developed in everywhere, especially to advise pediatric cases. So if you take the situation in Sri Lanka, it's a frequent reason for pediatric hospital admissions. We still see every ward perhaps get at least one admission every day in the casualty due to a toxic ingestion. And they include household, it's different to what you see in adults. They might present with ingestion of a pesticide or a plant poison like oleander, but in children, it's very vast. You can literally drink anything. It can be a perfume, it can be a other cosmetic product, it can be a nail polish remover, it can be any medicine, it can be any pesticide, can be a rat poison, can be a chalk, ant chalk. It can be anything, right? So it's very diverse. So you need a lot of knowledge to manage because the number of poisons are very diverse, right? And there are rural urban differences in exposure types. For instance, kerosene versus cosmetics. And we don't have national data. We continue to see this, but then we don't care. Most of the time, just they go home. No one collects data, no one do surveillance, no one trying to recognize the patterns, and then predict the future so that the prevention can be planned in advance. And these poisoning events happen within the child's home premises itself. It can be the kitchen, bedroom, bathroom, storage areas, right? If it's a rural area, it can be near the paddy field. It can be the pesticide store, and unsafe storage is one of the very common risk factors, right? And common agents ingested. So historically, we saw kerosene oil, hydrocarbons as the most common poison, because it's the most common thing that you can find in home household. And there can be household cleaning agents, medications left within reach to children, cosmetics, button batteries, small objects, like the other kind of common agents that are seen in young children. When it comes to medication poisonings, paracetamol, again, it's the common thing that is kept in household. Can be cough and cold, their own medicines, cough and cold syrups, antihistamines, whereas a teenager who's diagnosed with depression might present with ingesting their own medicine, antidepressants or antipsychotic drugs. And children do ingest grandparents' medicines. So they are on various anti-diabetic, antihypertensive drugs. They ingest and they present to hospital. And sometimes liquid preparations, like because of their color, because of their taste, they are quite tasty. Most of the syrups are very tasty, so children sometimes crave for certain syrups. So that can be a risk factor why a child, if they are not stored properly with screw-capped containers, children might enjoy drinking a syrup because of the taste. And household, like hydrocarbons and household chemicals, we frequently use these agents: hand sanitizers, Dettol, washing powders, bleaching powders, which can contain various acids, alkalis, and surfactants. So they also can cause corrosive injury, aspiration, and also they can cause local injury. Like if you put them on your eyes and skin, they can burn your eyes and skin as well. And kerosene oil, it's still common in rural households. It comes in various colors: blue color, pink color, which are very attractive. And they're stored in drink bottles, commonly stored in drink bottles. So children can easily mistake them to a soft drink and then drink. And people induce vomiting, as you all know. None of the poisoning events warrant induction of emissaries. Like, so no, there's no recommended first aid for any other poisons to induce vomiting. But our community, the very first thing they do is they try to induce vomiting. So this is one agent they try to do. And pesticide poisonings, it's not that common in urban areas, but here you see various kind of rat poisons. So rats are common in urban areas. So you see rat poisons and chokes, right? Deltamethrin, pyrethrin, they as the common insecticides. Compared to the conventional organophosphate carbamates, they are seen more in village areas where there's farming, farmlands, and people use as pesticides for their own farms. And it can be a cause of both accidental as well as deliberate poisoning in teenagers. And their mortality is quite high compared to other types of toxins. And plants and traditional substances, sometimes these toxic plants are grown in our own home garden or within home. For example, lucky plants, like you might have seen, within very affluent households, to get luck to your house, you grow it inside, right? It's a lucky plant, which contains calcium oxalate phosphorus, can damage your mucous membranes. And sometimes ornamental plants, oleander is one of the common ornamental plants. If you go to some of the nurseries, plant nurseries, you see oleander plants are kept because of their beautiful flower. So they are, they're sometimes promoted within our community itself, under recognizing the harm that can cause to children. And in complementary medicine, Ayurvedic medicine, although some of these medicines are used, but they are sometimes not regulated, giving access to everybody, right? So if you just ingest, some of the things can be toxic. For example, during a previous study, I noted like somebody came with poisoning of a plant, right? And then to give, as a remedy, they have given mashed nutmeg. Nutmeg itself a poison, right? So poison treated with poison sometimes can be seen, right? Yeah. So this is how we can see plant poisonings, but we don't anticipate these factors. And pre-hospital practices, again, a challenge in our settings. Most of the time, parents give harmful first aid, right? The safe first aid would be what? Safe first aid would be like if the patient is vomiting, you can keep the patient to the left lateral side and then call the ambulance, 1990 if it's available. right? And then make sure the child is transported in that side and then brought to the hospital as soon as possible, right? But most of the time, what we see in our communities is like they use something to induce vomiting. Okay, vomit out, and then you can aspirate, right? Especially if it's an alkali, acid, corrosive agent, it can aspirate and can have trouble due to aspiration, pneumonia, and chemical burns to the lungs, right? So, but they come to hospital, just by sometimes you just run to the hospital, right? Don't attend to how the child should be transported, right? So these are common challenges that we see in managing pediatric poisonings. And what determines severity, that is your risk assessment. It depends on the substance, its dose, the time of ingestion, the formulation, time to treatment, and child's weight, age, right? And it's important to remember the children can deteriorate quickly for the same reasons that we discussed before, right? Hospital management. So any poison, we follow, stabilizing the patient first. So managing resuscitation first before doing even a risk assessment. After that, you need to take a careful history and then do a risk assessment. And it's important to remember when not to do gastric decontamination. Sometimes even the doctors, they do decontamination, give activated charcoal for everything, right? Thinking that activated charcoal will bind to everything and then get rid of the poison, which is not, right? So you know that, right? So sometimes charcoal is not effective. Sometimes charcoal can be harmful, especially if you give to corrosives, right? And supportive care is essential. Timely supportive care and using antidotes when indicated is again important. Prevention strategies in children, it mostly happen due to accidental poisoning. So safe storage is very important, right? And sometimes you need to pay attention to safer packaging as well, right? For example, cough syrups locked with a screw cap, right? So it's very difficult because of the developmental level. It's difficult for them to open it, right? So safe packaging and safe storage both are equally important, right? And community education, that is very helpful intervention, like to counteract various harmful first aid practices in the community, right? So prevention and avoiding the harm caused after the event, like not due to the poison, but due to other factors. It's very important, right? So you can use community education, pesticide regulation. Again, because of the pesticide regulation, now we see quite a lesser number of pesticide induces compared to what we saw about 20 years ago, right? Most of the poisons are banned now, most of the harmful poisons. So way forward, strengthening pediatric poison information services, developing national poison surveillance systems, improving healthcare worker training, which I think what we do today, and integrate poisoning prevention into health programs and multi-sectoral collaboration. And I want to tell you about our center also today. All the resource persons, except one, like everybody is contributing to this center called KidsToxLK, Paediatric Poison Information Research Center, which is based at University of Kelaniya, which provides lateral level support to clinicians. So it's provided only to doctors, not to the public, mostly pediatricians or doctors from the rural hospitals who manage poison children, and this service is available for 24/7. And this is the website, and these are the core goals. Just you can go through. This is the number. Like if you're interested, if you come across any, if your patient is a child, you can call and then discuss if you have any queries. And this is a coordinated project between the College of Paediatricians as well as the Ministry of Health. And we have run this program for about 6 months. So you can see the distribution of calls where they were coming from, mostly concentrated towards the west part of the country, but getting to see calls from elsewhere as well gradually. And reasons for accessing the service, most of the time it's due to a case of pediatric toxicity, but sometimes you just request advice for about maternal ingestion if you are being, if the child is being breastfed, or sometimes not for case management, but for some information purpose. And what we have covered so far, you see some of the areas are the calls getting more from some of the areas compared to others. Could be due to lack of awareness, and also could be due to resource constraint. We don't want to kind of popularize it as well, because we don't want to answer too many calls, because we don't have that much resource available. And common types of poisons we have seen. So it reflects actually what we discussed so far. So major part can be due to cleaning agents, hydrocarbons, and cosmetics, and also to some extent paracetamol, non-paracetamol, psychiatric drugs, pesticides, and mosquito. These are the more common types. If you see in children, pediatric poisonings. Impact. So use of importance of having this service, right? So sometimes you give activated charcoal unnecessarily. So that's where, not you, I mean, I'm referring to the junior doctors who you may be giving activated charcoal to everybody. So you can kind of cut down it, right? So that we're trying to save resources as well as preventing a preventable harm, right? And sometimes avoiding unnecessary investigations, like you tend to do sometimes electrolytes, all that for everybody, right? ECG, so you don't need to do. So if you can do the risk assessment carefully, then you don't need to do, right? Sometimes. So I have listed all of them, right? So it can be quite useful. Right. So that's the end of first lecture.